Hello, BPHN partners and staff and anyone who is watching. I am super excited to be here today to just share with you some exciting programming that we have here in BPHN regarding obesity. But I also wanted to share with you some new information about obesity and Black health, new research, new body, mind, spirit resources, and really try to address the question, how can we heal obesity in our community? So my name is Dr. Sylvia Gonsahn-Bollie. I am a dual board certified integrative obesity expert. I'm a BPHN partner. I'm a best-selling author and founder of Embrace You Weight and Wellness, a digital health company that offers concierge medicine services, coaching practices, and also consulting. And I'm super excited to be here and to be a part of the BPHN network. So I will be sharing some information with you, and let's get started. Okay, so my disclosures and all are here. All efforts have been made to remain unbiased and to mitigate risk in this presentation. The objectives of this session are, at the end of this session, you'll be able to identify the unique contributing factors to the obesity epidemic beyond calories in versus calories out. Describe how to determine healthy weight beyond BMI, body mass index, and screening, and utilize BPHN resources for obesity prevention and treatment, including enhanced healthy weight and wellness sessions that start in January and will run through April of this year, 2023. Well, it's not this year. Okay, it's going to be 2023. So first off, I want to talk about our why matters. Obesity is a big problem. Healing our community, facts, feeling, faith, informing solutions. I use the 4 Fs. I love alliteration. And, actually, as I speak about feelings, I know the word obesity can trigger some feelings in people. And let me just clarify from the outset that that word is a medical term and a medical definition. I did a talk recently for blackdoctor.org, and some of the comments were, yeah, that word needs to change. And I agree, but I'm going to share with you in this presentation why it might be a little challenging for us to change the name, especially because we're just now getting obesity recognized as a disease. But please know that it's not meant to be an offensive term, and it is a medical term. And when possible, I'll try not to use the term. But if you feel any kind of way, don't tune me out, because I have good stuff and I care. So also, the main thing that I mentioned earlier, am very excited and feel very blessed to have been a recipient of the NCCF BPHN Wellness Grant Award. And so the project that my team and I propose is the Enhanced Healthy Weight and Wellness Sessions. And this is going to be a 4-month group of sessions programming in which we help individuals set a self-identified weight or wellness goal, not using the scale. This is looking at lifestyle intervention or medication adherence. And we are going to help them set that goal and stick to the goal beyond Quitter's Day. And if you don't know what Quitter's Day is January 19th. And that is when most people quit their New Year's resolution. So we're trying to get people past Quitter's Day. And so we just need your help to enroll them into this program, and it is free of charge. They actually get a gift at the end of it. We'll let them select what that gift is. Going to be something wellness oriented, but it's going to be worth their while. And so definitely have your patients, your clients, your friends, yourself sign up for it. And I'll share a little bit more about those details, but you can scan this QR code here to get to the registration page, and you will be getting this. It will be up on the BPHN website, and you will be getting it emailed to you too if you're in the BPHN partner. It'll be posted on all of our social media as well. So our why matters and why I care. I think it's important for you to know I am not just someone who is consumed by the statistics, but I really have skin in the game, so to speak. I really do care about this. So as I mentioned, I'm an integrative obesity medicine physician. It's a pioneering field, was pretty new. And I am also a women's health expert. I practiced primary care for about 9 years exclusively before switching over to obesity full-time in 2021, but I have been board certified in obesity medicine now going on, oh my goodness, I'm going into the 6th year of that, and that's super exciting. Actually, 7th year of it. I'm a global obesity expert. I'm on the Obesity Medicine Association Board of Trustees. I've been a consultant, as I mentioned, to Black Health, which is a national organization based in New York, and helped them with their obesity programming. To Novo Nordisk, I helped them with their obesity education as well. Livestrong.com. I'm also just recently joined the Medscape Board of Clinical Endocrinology as an expert there on their panel. I'm a best-selling author of Healthline.com's best overall weight loss book of 2022, Embrace You, Your Guide to Transforming Weight Loss Misconceptions into Lifelong Wellness. And I'm also a body, mind, spirit wellness strategist, meaning that I really help people figure out the solutions and their why behind what they do, especially when it comes to food and food relationships. Part of my training for that, I'm a certified group fitness instructor. I am a runner. I've run over 5,000 miles since beginning my own journey 8 years ago. And I'm a foodie and creative chef. I'm a daughter of restaurateurs. I love food. And I am a woman of God. I've been in Christian leadership since age 13. I'm a prayer warrior, a giver, and philanthropist. My husband and I actually run a STEM nonprofit in Liberia, West Africa. It's the only freestanding laboratory in the country. STEM laboratory in the country for high school students. So my journey actually starts here with my Grandma Sylvia. Yes, I'm named after her. And Grandma Sylvia was an illustrious woman. I heard myths and stories about Grandma Sylvia before I ever met her, because I did not meet her until she was 8 years old. And the stories that I heard, she was an entrepreneur, an educator, a leader in her community, just a dynamic woman. But by the time I met Grandma Sylvia when I was 8 years old, she was blind or vision impaired, secondary to glaucoma. She had diabetes, she had hypertension, and that she eventually suffered a massive stroke, which led her bedridden for the rest of her life. And this had a major impact on me because I saw it with my own eyes how health could just transform someone's life and really leave them debilitated. And on top of that, what made it even worse was not only witnessing this journey, but also her doctors who were looked nothing like her, looked nothing like us, and who were just saw her as a number because she was part of the Medicare, Medicaid system. They blamed everything on her weight. And so how I internalized this as a young woman and as a young girl was that, oh, you don't want to get fat or you don't want to gain too much weight, because if you do, it is going to destroy your life. And so I developed at a very young age what today we would call fat phobia. And I didn't realize it as such, but I became a yo-yo dieter. So I would go through periods, of course, growing up in the South. I'm born and raised in Atlanta, Georgia. We go from celebrations with lots of food, and because I have the West African background mixed with the Southern background, our parties would be lit. Okay, like, so there would be jollof rice and then fried chicken and mac and cheese until we bring the chitlins. I don't like chitlins, but then there'll be all the cakes, the pound cake, the key lime pie, everything, plus more rice, so I grew up with that heavy indulgence, and then you would go the other extreme and say, "Oh, I ate too much. Now I need a calorie count." And I have diaries back from when I was 15 years old where I was calorie counting. And that just blows my mind now. So anyhow, I continue this unhealthy relationship with food and going back and forth, restrict, indulge, restrict, indulge, no moderation. I continued this until pretty much most of my life. And my body kept up with this metabolic gymnastics because I was young, because I had genetics on my side. But when I got married and changed my eating pattern there, that's when I first experienced some weight gain. I gained the newlywed 15. But the real trigger for me was pregnancy, as it is for many, many Black women. The trigger for obesity for a lot of Black women is once we have our first child and never lose that baby weight. And I gained 60 pounds with pregnancy, partially because I was overworking. I also had preeclampsia. And I like to say my baby weight stayed on for 2 years because of a combination of sleep deprivation, people pleasing, and perfectionism. And it started to weigh on me professionally because I no longer felt confident in counseling other people on their weight or on their lifestyle because I felt like a hypocrite every time I opened my mouth. So then I tried to do what we learned in med school to do, which was to calorie count and to exercise more. But as a busy working full-time mom of a high needs infant, I I couldn't keep up with calorie counting and I couldn't keep up with trying to exercise an hour each day. And I felt like a failure. I won't even lie. I did after I tried. And when I was talking to one of my girlfriends one day and I told her, I just can't do this. I can't believe I said that this would never happen to me. And look at me. And she said, want something that changed my life. She didn't say, go get on another diet. She didn't say, here's this pill. She said, be nice to Sylvia. I like her. And just that simple statement was like a light bulb. And I'm a person of faith that said, so I believe God was speaking to me and saying, look, Sylvia, I'm not going to let you make a positive change with a negative mindset. You have to start with transforming your mind, transforming your heart, and how your relationship with yourself. Then we can work on the rest. So, as the word ladies of In Vogue say, free your mind and the rest will follow. And that's what I did. And so, that also, once I did that, I started making small changes, small substitutes. But I also learned that the science that we had learned in med school about obesity was wrong. And so, I became board certified. I started attending the obesity meetings, became board certified, became a medically supervised weight loss clinic, all the things. And that changed my life. And I was able to lose that weight. And that's more a marker of just all the other mental and spiritual changes that are made too. These are the external manifestations. Now, I'm showing these two pictures because I got pregnant again. And guess how much weight I gained then? 60 pounds. And this time on that pregnancy, I was exercising, I was eating healthy, I was doing all things, but some weight gain triggers, some obesity triggers are unavoidable. And pregnancy is one of those. It runs in my family. That was the trigger for my grandma. That was the trigger for my mom. That's the trigger. So that is a trigger. And so, but what I learned through that experience is that I knew what my triggers were. So this time I was able to lose the weight and keep it off in 7 months instead, because I had transformed my relationship with movement. I had transformed my relationship with food, and I could do, and I knew what I needed to do. And so that once I knew the truth, you couldn't stop me. I changed my whole life, my whole practice, and became very passionate. I lead the Overcoming Obesity Club on Clubhouse now, going on 2 years. We meet every Thursday from 12 to 1 and just help the public sort through all of the myths that are out there about weight loss and about body weight and living a life of wellness. I've spoken nationally, I've done international work and been featured. My book is a bestseller, as I mentioned. So all the things, but all of this comes down to just reminding people of your why. Your why is everything in anything you do. Your why. So why are you doing what you're doing? So as we go through this, think about that. Even as we help patients, as we help clients, as we help people improve their health in this BPHN space, why are we doing it? And that is what I want to help our clients do and understand their why. And I'm grateful to be surrounded by a team of people who also share the same why. And I'm most proud of helping 40 women and a few men discover their why during the pandemic so that they could not just lose weight, but keep it off as well. So now obesity is a big problem and it is really weighing on us as a community. So this is the CDC chart. You guys are probably used to these kind of conversations, starting with this type of map that just shows you how, especially in the Southeast, that our population makes up well over 40% of the people who have obesity. So in the United States, non-Hispanic Black, we make up over almost half of the population of people with obesity, but in certain states that is even more disproportionate. So there is a lot of work to do in this in our communities. Now, when you break this down by biological sex and race and ethnicity, you can see that Black women, 57% of Black women are in the obesity range. Now, the question is, which we'll talk about, is why, right? We always get stopped there on the statistics and they become a mantra, but the question is why. And I also want to remind you that this is about more than weight. Before we talk about why, let you know, this is about more than weight. It is a multi-org system organ disease. So when we look at some of the top diseases that are plaguing our community, and it is all related to obesity. So high blood pressure, diabetes, stroke, heart disease. Look at all the ways that obesity is linked to heart disease. So, and prior to COVID, we were winning, but now after COVID, we're going back to this stage where we are dying from early from these many causes. So this is why we need to address obesity. So how do we heal our community? And this is where we're getting to the why. Why? Okay, so we can use facts, we can use feelings, faith, and forming solution. There is not one size fits all. And that's what I want to say. The old model, even of medicine, right, is like the all-knowing doctor who does everything and treats everyone the same. Those days are gone. Like, we need a team. And this is why I'm super excited to be a part of BPHN, because it is a huge network. And when I think of Black Physicians Healthcare Network, I'm like, we are the foundation of Change Your World, because we have all the tools, you know, to really make an impact, not just at the system level, but even at the individual level. If we can really teach individuals how to leverage these tools that we have. So that's what really excites me about this. So facts. So for some of the things I want you to know, some of the newer science, that when it comes to obesity, it's more than calories in versus calories out. And also that when we think about healthy weight, right, this rail thin, twiggy, Anglo version of what a healthy weight looks like, or what health looks like, is outdated, and the science no longer really supports it, which is why I do a lot of work talking about this. And so one of the key things is this slide. And I know it's super busy. Don't try to squint your eyes and read it, but this is just showing you it's more than calories in versus calories out. These are all the contributors to excess energy storage. So there's things like trauma history, there's low socioeconomic class, there's maternal obesity, there's food surplus, there is racism, okay, like crime per. So all of these things go into why someone may gain excess weight. And so when we talk about, oh, Black women have the highest rates, or Black people have the highest rates of obesity, I think automatically of all these triggers. What are all the things outside of, oh, there's a McDonald's in the neighborhood? What are all these things that are contributing to it? And that's why we all need to work together, because some of them won't. And so this goes to the social determinants of health, right? Which those you're probably familiar with. And some of the key contributors: poverty, racism, incarceration rate, disrupted families. And so this is a very nice chart that was looking at the overall health of African Americans in the United States as determined by social determinants of health. Now, notice obesity is listed here as a risk factor, but I added in these pink arrows because it's a back and forth relationship between these social determinants of health and inequalities, and also with these other mortality factors as well. So it is very much related. It is very much related and not in isolation. And this is a helpful study from the Black Women's Health Study, which is one of the largest longitudinal, so ongoing studies of looking at the indicators of excellent health in Black women. And we've gotten so much great information from it. But when you look at it again, I like looking at this breakdown because a lot of it does go back to social determinants of health, right? Of what makes good overall health. Now, they weren't looking at obesity specifically, but a lot of these factors do play a role in obesity. So it's having more economics. Now, interestingly, for Black men, having a higher economic status actually puts you at risk for obesity, and particularly if there's less time for family. So that's an interesting difference with Black women, Black men, and Black women. So having fewer experiences of everyday racism and discrimination is associated with better overall health. Again, being a college graduate, eating healthier portions of fruits and vegetables, brisk walking. So some of these things you can control and some things you can't, but it's helpful to know and how we can work together. I want to switch gears a little bit and talk to you a bit about the body mass index. So this is the most common screening tool that is used in the clinical setting to screen if someone may have obesity or excess body fat. Notice that I am saying screen and may, because this tool is inappropriately used all the time. It's inappropriately used all the time. And really what few people fail to realize is that the BMI actually started not in the United States, but in Belgium in 1832 in a group of Belgian people. And all this gentleman, Dr. Quint, not even doctor, but Mr. Quintelet was doing as a mathematician and anthropologist was simply just categorizing the people based on their height and their weight. And he thought this was such an interesting calculation, filed it away, went on to glory. Come to find out, in the 70s, in the 40s, actually, it was a common practice to have these life tables, which classified people based on their weight and denied them insurance coverage. So Dr. Ansel Keys, who is an American physiologist, he was appalled by this practice. And so he wanted to find a way to standardize this practice. And so he thought back on this, you know, this calculation that he had read by this Mr. Quintelet, and he reused it and repurposed it and called it the body mass index. And so by 1985, it was adapted by the WHO and the National Institutes of Health, and it has become our standard for screening for BMI. But there are some serious things that we need to know. We know that BMI is incorrect, especially in Black people, based on because of differences in muscle composition. Now, I just wrote this piece and we went back and forth in it about race. And I get it. And I talk about that in a larger talk on this, that what is race, right? You look at someone and you decide that, of course, we all are probably different, right? And it has more to do with geography, it has to do with genetic differences, things like that. But for now, we can see that in certain groups of people, there's certain, generally speaking, attributes. And so we could, until we have the tools to do bedside precision medicine, which is really what's needed, this is the best indicator. So in general terms, Black people tend to have more lean muscle mass at a higher body weight than our Caucasian counterparts. So in that case, there are times when the BMI will overestimate obesity. And then women also have a higher body fat percentage as well, which needs to be taken into account, which is why they do have the male and female slides, but still it's not enough. So all this to say that there can be an overestimation of obesity with BMI threshold. Now, why does this matter? I'm going to talk about it a little bit later. It matters because a lot of times, our patients, right, will say, I'm not obese, I don't have obesity, and I'm wondering now some of those conversations because people do have a good sense of themselves sometimes, it's not all denial. It is actually people have a sense of where their happy weight is and where it is. So anyhow, I'll move on because I have whole talks on that. But I want to just say that BMI limitations, where do we go from there? So I'm very pleased that there are two fabulous Black sisters who are doctors and highly learned, one of which is a friend and a colleague, Dr. Fatima Cody Stanford, but there's also Dr. Sabrina Strings, and they have been well published, well studied, should we continue using BMI. Dr. Sabrina Strings, leader of the Health at Every Size movement, says, no, we should not, because from a sociological perspective, she feels that BMI is just a tool of our systemic racism and systemic racist past. So she says, no, we should not. Whereas Dr. Fatima Cody Stanford, who is a well-researched and studied Harvard professor, says, yes, we should, but we need to modify it. Now, because I have seen the deleterious effects of obesity on a professional level, on a personal level, I'm gonna go with Dr. Fatima Cody Stanford, though I have mad respect for Dr. Sabrina Strings and appreciate her sociological perspective on this topic. So Dr. Fatima Cody Stanford and her colleagues, they put out a modified BMI threshold, a modified BMI chart based on race, ethnicity, and sex. And I circled here are for the values for Black women and for Black men. Now, notice here, this actually is kind of alarming because if we were to adjust, remember, we define obesity currently, we say people are at risk for obesity when their BMI is greater than 30 kg per meter squared, right? So, but if you look here for Black men, it's actually a little bit lower. So we may be missing some of the early signs that risk factors that put Black men at risk for heart disease. Think about all the Black men in their 50s who have died this past year with heart disease or some sort of cardiovascular incident, Bismarcky, Coolio. Like, so, that is really alarming to me, and it just says that maybe we need to start screening earlier and diagnosing earlier so we can start doing some intervention earlier. Now, for Black women on the converse, actually, when we adjust using this risk curve analysis, then what we tend to see is that our curve shifts upward. And this corresponds with some other studies that show that Black women tend to have more subcutaneous fat, but not visceral fat. And remember, visceral fat is that fat around your organs that puts you at risk for metabolic syndrome, insulin resistance, things like that. So that being said, then this does make sense. So anytime I see new data, right, I'm like going and comparing, I'm saying, does it make sense in the context of everything else, right? Because the study can be wrong, of course, right? But this makes a lot of sense, especially with what we've seen through the years. So I want you to be aware of this, BPHN, clinicians, partners, because as we shift our thinking and as we work towards better individualized care, this is something that will come up again. So I am grateful that this is making news. I appreciate, like I said, I stand on the shoulders of amazing colleagues who've been doing this work in the trenches, doing the research. I'm a voice piece. My middle name literally means voice. And so I've been able to write about it, to talk about it, amplify the work that they're doing, and we're all continue to do, because we need better tools so that we can better treat people, or else people will continue, like those influencers and things like that, saying they're wrong, look at this, and we won't be able to effectively reach the people we need to. So that goes into feeling. What are the feelings surrounding weight? Okay. And this obesity in our community. That's something we need to address, because I'll be talking about body positivity, happy weight, and mental health. So I'll start with mental health, okay? Because that is the foundation of everything. And I like to say mental health is health, period. It's health, period. And that's another soapbox issue. It is, because if we don't stop treating the mind like it's separate from the body, we can never really get to the root cause of of it helping our patients heal, helping our community heal. Okay. So when it comes to weight status or obesity and mental health, it is bi-directional. It's bi-directional. Having obesity increases your risk of depression, poor quality of life, chronic pain, occupational stress, all of these things. There's weight bias in various settings. Doctors, when sometimes I have to pause and not read the comments for some of these pieces I write, because they are so filled with weight bias. And I'm like, man, this man said been treating this doctor for treating patients with obesity or with metabolic diseases for 40 years. And he's been thinking about them this way. So, we need to check ourselves. A great tool for this is the Harvard implicit weight bias test, and you can take that for free online. I take it every year just to check my biases. And it's important because biases can go both ways. And some years I do it, and it actually tells me that I'm actually biased towards favoring people with larger bodies over people who have smaller bodies. And I don't want to have any bias. So I like doing it just to keep me fresh and make sure that I'm staying balanced and neutral in my approach. And I encourage you to do that. And then psychiatric medicines increase weight gain as well. So our medication. So one of the key things I do when I screen people, and I mentioned that I am open and available to do some screening consultations, obesity consultations in the BPHN community. One of the key things I do a medication reconciliation, make sure there are no weight positive medicines that could be contributing to it. And then emotional eating, disordered eating, as I mentioned, my own journey with this, is so important to deal with that, because if not, we don't. And this is why a lot of work I do is also helping people shift their relationship with food. It is a relationship. We can focus on a diet and a what, but that's why they fail all the time, because if you don't change that relationship, you're going to keep chasing diet after diet. Now, toxic environments. So this is dealing with the pesticides, dealing with the stress, and dealing with relationships with other people. Okay. And then trauma. I cannot tell you again, there is something called the Adverse Childhood Event Score. This was actually developed in an obesity clinic, because they found, what the doctors in that clinic found, Dr. Belletti found, is that when people had a significant history of childhood trauma, they were more likely to regain weight that they lost. That is protective in the body. Let us never forget that. And so there are reasons why the body tries to hold on to fat, physically and psychologically. So I want to talk about body positivity, because Black women in general have been found to have higher confidence scores or body or self-perception of lower body weight than our actual body weight at the same BMI compared to our Caucasian colleagues. And a lot of it has to do, yes, with our peers. And if we're comparing ourselves to our peers, right? And if everybody is voluptuous, then hey, and I just fit in, right? Or I'm not as big as that person. I'm not as large as that person. So I'm doing fine. So that's one thing that's going on. And in general, it also curves are accepted in our society. You don't want to be too thin. People think you're sick. People think that you are not where you're supposed to be. So it's important to keep this in mind as we're approaching our patients, right? And we're talking about healthy weight. We want to make sure that their healthy weight and happy weight are in alignment. It has to be in alignment, because if it's not in alignment, what's going to happen when we're talking about healthy weight is going to go through the ears. So we want to make sure, number one, our healthy weight assessment is correct and it's accurate for the individual that is in front of us. We're not using big charts that are based on the wrong groups of people and telling people that they should fit into that. So that's one thing. And then the second thing is that we are actually listening and seeing, where are they happy, where are they comfortable, and meeting in the middle. This is that shared decision making, right? That shared decision making that we are to do in medicine. This is part of that motivational interviewing technique. So so we can continue to utilize that. So moving on to faith, spiritual health is important as well. Okay. And when I talk about spiritual health, sometimes when we talk about spirituality in Western medicine in particular, again, I'm a, traditionally trained allopathic MD here in the DC area, graduated from GW, grateful, thankful, humbled, haha. All right, but I'm very appreciative of that. But I will tell you that people get weirded out, right? When you talk about spirituality, because they automatically, the mind runs to religion. Now, religion and spirituality are two different things. They're cousins. They can be cousins, but they're not exactly the same. In Embrace You, how I define spiritual health is connection with God, self, others, nature, your environment around you, community, your sense of belonging, purpose, your group, your tribe, and then charity. How are you giving out? But we are so quick to give. How are we also receiving? How are we receiving with that level of reciprocity? And then creativity. How are you? We were born creators. Even if you're like, I don't have a creative bone, because you box yourself into thinking that creativity is singing, dancing, painting. It doesn't have to be that. How are you expressing yourself and generating new ideas and thoughts? Now, when we look at this a little bit in some of the studies, again, going back to that Black Women's Health study, we see right in our area, in the Washington, D.C. area, one of the factors that's reported as having good or excellent mental health is having spirituality. Again, if we tie this in, this was not directly for obesity, but if we tie it into the larger picture, especially looking at some of the faith-based interventions, studies that have been done for weight loss and obesity, that integration of faith and the role that the faith community plays is so important. So this is one of those studies that I showed. So and what they found here is that there was key things that the churches could do, such as serving waters at events, not serving fried foods at the event, and all of that could help with improve especially physical activity, and improve overall wellness, and improve consistency as well on the journey. So it does take us, and that's why I said at the outset that our BPHN community is so rich, because we have all of these components already built in. So if we can work together, it will help tremendously. So time for solution. So how do we heal? So I hope you've seen how we heal is faith, feelings, using the actual facts, and then now forming solutions. And that's why I'm excited again, like I said, because with it takes now, I'm going to shift to the eyes, integration. So one solution does not work. It doesn't work. So we need a body, mind, spirit approach. And that comes with dealing, like I said, each of us, not just on the public health space, but also on the individual level, being able to recognize what that individual needs and making sure that they're associated with the right person. And that takes involvement, right, of us all being on deck. And then innovation, coming up with new tools and using new data and using new technology. When I started this work, I used to say 100 years from now, I dream that people will come in and be able to get the most individualized assessment possible. Now I say 5 years. I think 5 years from now, we're going to be able to do nutrigenomics. We're going to be able to really hone it down. So embracing that new technology, embracing the new information we have, and not getting stuck in our old ways, and then individualized patient care and instruction. So that is what healing obesity in our community is going to take. So how are we going to do this very practically? So one thing is networking, collaborating. You're watching this, so making sure we're paying actually utilizing each other's services and not working independently trying to be the Lone Ranger. I am a survivor of Lone Ranger syndrome, and now I happily welcome and embrace a team, because I know together we can go further, right? Together, this is a big problem, as I said, and it's not going to be solved by one person on their own trying to do everything, but by us working together. And there's so many tools in this network. We have the physical health service, the mental health service, COVID-19 testing, which has been integral. And we know that COVID hard hit our patients with obesity and I saw it. I was working on the front lines in Prince George's County. I saw it. So food resources and fresh produce, and then community engagement. So all the things I mentioned there. So that is why it brings me again to our enhanced healthy weight and wellness sessions. And really part of this grant is that what we want to do is make sure that all of the attendees are aware of the services that are available to them and how to connect to them. Now, of course, we have referral partners, but sometimes maybe the patients or the clients may not really realize what to even ask for. So our goal is to make sure that they know what to ask for these goals that they have set up. So again, it's going to be a 4-month program. We'll meet 2 times in January, then we'll meet monthly to make sure that they stay on track with their goals. And if who all the participants is free to enroll, they actually will get a prize. So all the participants who enroll and stick to the end, even whether or not they meet their goal, they will get a prize. So I again am asking you to please refer people to us. Like even, if you just have someone who needs to learn more about healthy weight, health, wellness, and they need a way to stick to their goals, it will be helpful. Now, few key things, all of our services are going to be virtual. So they need to be able to have basic computer skills and be able to log in. And if they can do that, then they would be a great candidate. So you can have them self-enroll. This is the QR code to enroll. And I will also be sending it out again to the partners. It'll be a part of our weekly announcements. So in terms of stakeholders, please feel free to collaborate, reach out with me. I will give you my contact information at the end. That's going to be the last slide, but we can, and if you think that your practice or your organization offers something that could be very beneficial for people who are struggling with obesity or who are overcoming obesity and want to get to their healthy weight, then we can please share those resources and we'll add it to the directory that we're handing out. Looking forward to connecting with all of you all. And again, it has been a pleasure sharing with you today. And once again, our objectives were to identify the unique contributing factors of the obesity epidemic beyond calories in versus calories out, describe how to determine healthy weight beyond BMI and screening, utilize BPHN resources for obesity prevention and treatment, including the enhanced healthy weight sessions in January and in Embrace You Wellness, Weight and Wellness. So feel free to reach out to me. I'm here, I'm active in the BPHN community. I'm happy to accept consults, either just to figure out a plan and you will take back over as the primary care physician, or I work in 3-month blocks with people. So if you have someone who needs to do that deeper work of really transforming their relationship with food, with the relationship with movement, we pick one core area in the BPHN program, and then we'll work through that for 3 months at a time. I'm happy to assist with that. So once again, thank you, thank you, thank you, thank you, thank you. Here is my contact information. You can either scan the QR code, feel free to send me an email, and be sure to check out the BPHN Enhance page. So thank you, and have a wonderful day on BPHN Partners, and look forward to seeing you soon and working with your patients and clients. Again, I'm Dr. Sylvia Bollie, your dual board certified integrative obesity specialist, best-selling author, founder of Embrace You Weight and Wellness, and in fact, creator of the Enhanced Healthy Weight and Wellness sessions in the BPHN network. And I am looking forward to working with you. Thank you and have a wonderful day.